Hi again, Elizabeth Scala here from Living Sublimely Well, talking on the topics of elbow surgery and recovery. Yes, I've had elbow surgery around 11 months ago and was really impacted by it. So I didn't know anything to expect. I didn't know what to anticipate. And then after the surgery, started looking around online and realizing there really is not much out there related to the patient's perspective. Sure, I found those surgical textbooks and nursing diagnoses and all these types of medical things, but what about the patient? You know, what about us? What do we expect? And then how do we recover? How do we heal from this invasive procedure to our beautiful elbow? That's right. There's my beautiful scar. Okay. This topic today, and there are tons of videos in this playlist, lots of information related to how you can heal holistically from this procedure, but also just things related to the procedure itself and what to expect. So take a peek around the playlist. But today I want to talk about like pain, and I've had other videos about pain, but this one specifically is about how the physical pain can be impacted, actually can be, I'll say, increased. Your physical pain in your arm can, did you know, be increased by emotional or mental pain. Did you know that? Have you ever noticed how all these things are related? Mind, body, spirit? Maybe not. I'm going to give you an example, a brief example, a story. I'm not going to get into terribly, like a ton of detail. Lots of this is going to be in my upcoming book related to healing from elbow surgery. But a family member of ours struggles with addiction, as many family members do in all families. So I had surgery in the month of August. And in that particular month, actually, this family member had a relapse from being sober, clean from drugs, and had a relapse. And, you know, okay, the family member is very close. It's my husband's sister struggles with drug addiction. And in August, the same month I had surgery, she had a relapse. One day, and this was, let's see, 2 or 3 days only after I had surgery. And initially after surgery, my physical pain was really taken care of. My physical pain was minimal. The medication that my surgeon was prescribing to me, I took it minimally. I took it as needed. And when I did, it would help with my physical pain. And I kept my arm iced. I kept my arm elevated. I was doing everything to reduce swelling. So my physical pain was under control on this particular day. However, I noticed my husband was like busy, you know, had his head buried in his phone and had this scowl on his face and was kind of not really communicating with me. And by the end of the afternoon, I knew something was up. Like I had a hunch, you know, you're the wife, you're the partner, you're the spouse, you know your spouse. So I had a hunch. I'm like, oh gosh, my husband is struggling. And I pretty much think I know what it's related to. And oh boy, here we go. So when we finally started talking about everything, and then we started crying, and then we started becoming angry, not even at each other, just about the situation, and it got emotional, and we got upset. I mean, and I was, at this point, slowly noticing an increase in my arm pain. So my arm pain was under control. The whole day I was icing, I was sitting, I was taking my pain medication, I was coloring on my front porch. I mean, I was having a day and my arm pain was under control. Physical pain, under control. And then an emotional tick, an emotional upset, emotional pain made my arm hurt more, to the point where at dinner on that particular night, I was sobbing, crying from now physical pain. I was throwing an adult temper tantrum, and it just got out of control. And the next day, after I had time to rest and reflect and think about everything that had happened, I was like, aha! The light bulb went on. Emotional pain or mental pain increased my physical pain, literally. So think about this for your own healing. As you recover from your elbow surgery and as your arm is physically repairing itself and regenerating new tissue, the bones are fusing, new cells, just new growth, you know, you're healing physically. Do your best to minimize emotional or mental pain. Now, things are going to come up, and of course, life is going to happen. But do what you can to minimize it. So what are some examples? Well, don't go seeking bad information. Potentially, you might consider turning off the news. Perhaps you don't talk to, for a little while, that family member that always ticks you off. You know, don't seek out emotional pain. Don't put yourself in a situation where you know you're going to have mental pain later in the day because of all that angst that's going to come up from it. You know, minimize people that are negative around you, like minimize negativity in your life. Don't go scrolling around your phone and reading all of the mass media news and what have you. Surround yourself with happy things. Surround yourselves with positive things, uplifting things. Because again, you need all of your energies. You need your emotional health, your mental health, your spiritual and energetic health. All of this health, all of your energy to go towards your arm to help that physical healing. If you put yourself in situations around people or even circumstances or events that are going to make you feel sad, that are going to make you upset, that are going to make you get angry, guess what? Physical pain is going to rise. So all pain is interrelated, and I just urge you to consider what you can do to keep that mental, emotional pain down, because that'll help keep the physical pain down. All right? Don't believe me? Try it out. Go get yourself in a fight and see how it impacts your elbow. All right. So I'd love to hear from you. You know the drill. Comments, questions below. My website is Elizabeth Scala. My name, elizabethscala.com. You can check it out for some more information and resources related to healing from surgery from the patient's perspective. All right. Take care, good friends. We'll see you next time.